Attorney General, do we have communication with you?
Yes, sir. I can hear you just fine. Thanks.
You ready to proceed?
I am.
All right, we'll get started. Welcome, everybody, and I'll call to order the meeting of the Board of State Prison Commissioners scheduled for today, Wednesday, December 19th, 2024 at 10:02 a.m. And we'll kick it off with the roll call. Danielle?
Governor Lombardo,
Here?
Attorney General Ford,
Here.
Secretary of State Aguilar. I understand that he is not present at this meeting, but we do have a quorum, Governor.
All right, thank you. We'll move on to agenda item number 2, the first opportunity for public comment. No vote or action may be taken upon a matter raised under this item of the agenda unless the matter is specifically posted on the agenda and as an item upon which action may be taken. The Board of State Prison Commissioners will impose a time limit of 3 minutes. The board may place reasonable restrictions on the time, place, and manner of public comments. The board, within its discretion, may allow for public comment on individual agenda items. Please state your first and last name for the record. Do we have any public comment there in Las Vegas?
Yes. Yes.
We have 2, sir, Governor.
Okay, have them come forward and identify themselves.
See,
Oh, thank you. One at a time or? Okay.
both of you guys together or just one? Just let her go first and then we'll go to the next one.
Thank you. Good morning. My name is Lori Beecher Valenzuela, Lauriebeecher-Valenzuela. I'm an activist with Return Strong, and I'm here to read a letter from another mother who lives out of the country. She states, I'm writing to express my outrage and deep concern about the lack of adequate medical care and the appalling quality of food in our prison system, issues that have been further driven into crisis by the prison swap. My 2 loved ones, along with thousands of others, are struggling daily to survive in these inhumane conditions. Despite submitting countless medical kites, my loved ones' pleas for help go unanswered. When they manage to speak with a nurse, they're told they are just one among 500 others in need of care, are instructed to simply deal with it. How is this ethically or morally acceptable? This neglect is not only unethical but dangerous. The facilities need properly trained, compassionate medical professionals who are equipped to meet the needs of incarcerated individuals. Medical care should be about rehabilitation and healing, not leaving people to deteriorate behind bars. Adding to this crisis, my loved ones, along with countless others, are being served food that is labeled not fit for human consumption. It fails to meet even the most basic standards of nutrition and quality, resulting in severe health issues and long-term damage. Nutrition is fundamental to health and well-being, yet this most basic necessity is routinely denied. Forcing people to eat food unfit for livestock is not just neglectful, it's humiliating and dehumanizing. My loved ones have endured frequent bouts of stomach issues, tooth decay requiring extractions, and injuries that go untreated, issues exacerbated by malnutrition. The prison swap only intensified these problems. Rather than addressing existing issues, the swap created new ones, widening the gap in care and resources. We as a society must ask ourselves, why should someone enter prison and leave as a broken individual, sick, malnourished, and further damaged because of the lack of medical care and nutritious food? This is not justice or rehabilitation. It is cruel. The lives of all incarcerated individuals matter. These are people, these are mothers, fathers, sons, daughters, families, and friends worthy of basic dignity and humane treatment. They need solutions and they need them now. Let's work together to address these issues and to end the suffering that has now become the norm behind prison walls. I thank you so much for listening.
Thank you.
Good morning. Thank you for allowing me to speak today. My name is Lori Roble. I am here on behalf of my nephew, Anthony Roble, currently incarcerated at Southern Desert Correctional Center. I stand before you today to address a critical issue of medical neglect. Over the past 5 years, Anthony's incarceration with the NDOC has been faced with numerous health challenges that should have never occurred. Proper nutrition and timely insulin administration are vital to his survival. Yet the urgent pleas for him for help often fall on deaf ears. He is dismissed, told he is not special, and informed that insulin is not an emergency. Despite the fact that the lack of insulin can be life-threatening, it is deeply concerning that the medical staff does not seem to understand the basic principles that insulin and food must go hand in hand. For example, on Thanksgiving, after their main meal around noon, Anthony was required to have his evening shot at 2 p.m. in the afternoon. The scheduled decision raises serious questions why an evening shot would be given so early. Why was this done? Was it simply to accommodate staff convenience? Diabetes knows no holiday, and neither should any essential timing of any medications. Moreover, Anthony's experience with his blood pressure medication is equally troubling. Each month, he has to fill out a form requesting his daily or his monthly medication. And it does not happen all the time. This last month, he was 3 weeks without his blood pressure medication. I don't understand how this is acceptable. Additionally, Anthony has ongoing issues with an ear problem and took months for him to see a specialist. The specialist is recommending a CT scan, but I can only imagine how long that will take if it happens at all. This is just not a matter of health. It's deeply affecting Anthony and our family. I urge each of you to reflect on what you would do for your own loved ones in this situation. I am not just asking for action. I am begging for you to intervene. How many more times can Anthony be found unresponsive before someone will take this seriously? Thank you for your time and consideration.
Thank you.
Morning. Happy holidays. My name is Calais Casorso. I'm a volunteer organizer with Return Strong and a member of its board of directors. The atrocities happening within Nevada's prisons, especially over the past several months, are beyond comprehension. The treatment of human beings in these facilities is so egregious that it evokes comparison to some of the darkest moments in human history. Today, I'm here to share part of a letter we received from a man currently incarcerated at High Desert. He was not part of the recent transfer to High Desert. He was already there. This individual, a son of one of our family members, detailed his firsthand experiences of observed use of force, being denied meals, verbal and physical abuse by correctional officers, and a schedule of lockdowns that have persisted for months. He recounted a horrifying incident in which 2 individuals refused to be rolled up. The cells they were being moved to were covered in feces. This filth was a result of 2 individuals with severe mental health challenges who had been throwing feces from the second tier, which contaminated the entire first floor. Instead of addressing the root issue, correctional officers decided to move the individuals responsible for the feces to the first tier to limit the spread. When the men refused to enter such filthy and biohazardous conditions, the officers called the CERT team. Both individuals were beaten, tased, and forcibly placed into those same biohazardous cells. Disturbingly, there was no video footage of the incident because the cameras weren't functioning and the handheld cameras were not being used. One officer reportedly taunted one of the individuals by saying, "Swing, mother effer," baiting him to retaliate. Adding to this, on November 7th, Urban Hawk was murdered by his cellmate in another high desert unit. By November 22nd, Return Strong was notified that the cell where the murder occurred had still not been cleaned. The feces-filled cells were also untouched. We reached out to Deputy Director Williams regarding a reported stench in Unit 3, which was so severe it was making people physically ill. While he assured us he would look into it, we have not yet received an update. But honestly, does it even matter now? Why should it take an outside organization to pressure Nevada Department of Corrections to clean up feces and blood in the first place? Our member has also included a detailed log of yard and tier time documenting how rarely they have been allowed out of their cells. As of November 26, 2024, inmates in his unit have had a total of 10 hours and 25 minutes out of their cells in 3 months, from September 1st to November 26th, and 0 access to the yard. I want to ask you this. What have you done since September 1st? How many times have you felt the sun on your face, gone to bed in clean sheets without
Use
rats
H3
and bugs
minutes.
crawling all over you? Okay, thank you.
Is there anyone else?
Will there be a second one, or should I be going now? Okay, I'll go now. Hi, I'm Christine Essex. And do you need my address?
Just your name.
Christine Essex, ESSEX. This letter expresses my gratitude and a plea for support in addressing critical issues faced by my incarcerated son, Richard Essex. Richard is an amputee with anoxic brain damage, major neurocognitive disorder, and seizures. He has faced lapses in receiving his medications, particularly at High Desert, where he was left 5 days without them, any medication. And enduring this, endangering his health. Seizure meds cannot be missed. Communication breakdowns prevent me, as his legal guardian, from being informed promptly about medical emergencies. And Richard's inability to recall his medical history complicates his care. I would like to emphasize Richard's compliance and good behavior since 2016, noting his successful adherence to house arrest before incarceration. With only 1 year remaining before eligibility for parole, my primary concern is his health, including escalating seizures, need to see specialists, and urgent needs for prosthetic liners to prevent further amputation. Additionally, proper nutrition in the facility would support his physical and mental recovery. The food he eats does make a difference. As his legal guardian, I am here to advocate for Richard's release into my custody to ensure proper medical care with specialists to prevent further cognitive damage and improve his overall health. Whether he could be put on house arrest or whatever it would take, he can't get the specialists in the facility that he's, any facility basically. We also call for better nutrition for all incarcerated individuals to support their health, rehabilitation, and decision-making. It makes a big difference what they eat. So NNCC is the best medical facility in Nevada, and that's where he is currently at. And I have a good working relationship with the warden there, Warden Henley, and am extremely grateful. So I'm not here to complain in that, yet his hands are tied. There's not much he can do as far as giving me guidance or support oftentimes with Richard and what is possible for, getting him the best care needed. With that said, I'm just asking who can help me with these issues, with his medical and nutrition needs, or getting him the proper medical diagnosis, or back into custody where I can continue to take care of him as his legal guardian. And again, I ask that it be looked at, that he hasn't had any infractions or problems. I'm just lost at how do I help him. And I understand the system itself it's difficult because everyone makes different decisions, but that's all I say. And I appreciate your time, and I'm grateful. Thank you.
You said it was someone else?
Hmm?
You said it was someone else?
No.
Oh.
Oh, I'm here, but she's not talking. I think we're good.
Is there anyone else for public comment?
Thank you.
That's it for public comment here in Vegas, sir.
Good morning, members of the Board of Prison Commissioners. My name is Nicole Williams. I am a family member with a formerly incarcerated spouse and a volunteer and board member with Return Strong. I am also the staff mail coordinator. Every single letter we receive crosses my desk. I pick up our mail, scan it, and triage it. I am here today to amplify the voices of those living in Nevada prisons who have entrusted us with their stories of unimaginable hardship, neglect, and outright inhumane treatment. Since our inception, one of the core missions of this organization has been to ensure the voices silenced behind those bars are heard. Over the past few months, we have received an overwhelmingly number of letters. We currently have 1,134 letters from people around the state, the majority from our members who are incarcerated individuals at High Desert State Prison and Ely State Prison. Their experiences paint a devastating picture of systemic failures that undermine human dignity and violate basic human rights. These stories share common themes that demand immediate attention. 1, inhumane living conditions. Prison units are described as filthy, with cells infested by insects, toilets that don't function properly, and no access to basic hygiene or hot water for weeks on end. Clothing, when provided, is the wrong size or insufficient, forcing people to live in squalor. Laundry services, when available, reportedly use the same equipment that cleans communal mop heads, leaving clothes unsanitary. 2, lack of basic services. Many inmates describe enduring months without access to yard time, meaningful programming, or even showers. Some are allowed out of their cells for as little as 15 minutes every day, if at all. Medical and mental health services are either non-existent or alarmingly inadequate, with delayed or outright ignored requests for care. Even basic communication tools like grievance forms or kiosks are routinely withheld or not accessible. 3, dangerous environments. Several letters detail a lack of protection from violence, including being forced into mixed units with known enemies or being shackled and left vulnerable during transfers. Reports of staff negligence, provocation of violence, and threats of harm are common. These practices have created an atmosphere of constant fear and instability. Neglect during the High Desert State Prison and Ely transfer. The mass transfer between High Desert and Ely was disastrously executed. No one died or was assaulted during the transfer, but the aftershock continues and facilities have still returned to normal operations. We wonder if there will ever be a normal. Inmates were moved without access to their personal property for weeks. Many describe being left in freezing cells with no blankets or warm clothing, while others recount being crammed into cells previously deemed uninhabitable due to prior damage or contamination. Systemic dehumanization. Many letters express the profound emotional toll of being treated as less than human, from being mocked and called derogatory names by staff to the complete
You've
lack
reached
of
3 minutes.
communication or clarity around their custody status. Thank you.
Thank you.
Hello, good morning. My name is Morgan Darcy, and I'm just going to go rogue on
The
this.
Darcy.
Darcy. I'm going to piggyback off of what Nicole just said regarding the moves with the change. My loved one has been transferred from High Desert State Prison to Idaho, and in that time that he's been transferred, he has seen a dentist. He has been outside more times in the week that he was there first than the entire time that he's been in High Desert, which according to him was only 4 times he was let outside. He has access to better food, healthcare, mental health. He has education. What we're battling with right now is NDOC has said that they have transferred all of their belongings. Nobody has gotten any of their belongings since the transfer. Nobody can find the transfers properties. Nobody can find where the monies are that were on their books or their trust. Everything's still in limbo from down here. Moving up to Idaho is more of a model for what NDOC should take into consideration on what to be a part of. At these facilities at Idaho Corrections, they have access to schooling, they have access to tablets, they have visitation, they are able to work towards getting for their parole and probation versus here, where it's not something that's a priority. When my loved one told everybody that he was going up for parole in a year and a half, Idaho State Corrections said that he was on the top priority to start getting him ready to be a part of society again. What he went through here is beyond horrible. The things that he has witnessed, the suicides, the stabbings, the lack of nutrition, the fact that he would give up his servings of food to feed other people, and it still was not enough to maintain everybody's needs. I'm asking in consideration to think about how to better for our individuals that are incarcerated. Thank you.
Thank you.
I think it's. Do I have to say my name? Jody Hocking, JODIHLCKING. And I just wanted to actually add a little bit to what Morgan said. I was going to talk this morning about some of the unintended consequences following the mass move, specifically for people who were not part of the reason that it happened. Many of the people who were PC at High Desert now are either still at High Desert or they have been moved to Ely. And the impact is different for both of them, but I think it's significant at the same time. And it was things which I think Director Zarenda, I've said to you, we call it the aftershock of the moves and like the impact that has happened to people. So at High Desert now, we have people who were moved out of state due to their like high-level security concerns who now are doing well in other states, which makes me ask why. Why are they doing well there? Was it an impact on those people that it was their behavior, or was it our system that is not working for people? On the other side, we now have people who are at High Desert, who were at High Desert, who work in prison industries, who are, many of them are PC, but they didn't get moved to Ely, who are still being belly chained and shackled to go to the showers, to use the phones, to do anything. They're medium security, and somehow they've gotten mixed and are being impacted at High Desert. And I know High Desert was supposed to go back to like normal operations. I forgot the date, but I want to say it was in mid-October, and we're not there. And we're not even close to there, and we're actually now doing more harm to people who were doing well, and now the people who were not doing well are going out of state and they're doing well, which is a reflection on something that's happening in our system, right? In some ways, it's gone backwards at High Desert to the point that it was during COVID. COVID, prison industries, all PI workers were going to PI. They were working and they were coming and getting locked down and shackled and not getting yard and tier and all of those things because of COVID, but they were in the same room working. Now it's the same impact for a different reason. And at some point, you know, we passed SB 307, which put a very strict definition on solitary confinement, but people at High Desert are living for months. They have been 4 or 5 months in the same conditions that exist for people who are in solitary confinement. But because we changed the definition during the legislative session, it's been like a free-for-all for them.
You've reached 3 minutes.
I wasn't done yet, Danielle. That's all.
Thank you.
There we go. We're good. It's my first time. I'm nervous. My name is Sandra Valentino, Valentino. I have a loved one incarcerated at NNCC and am also a volunteer with Return Strong, and I'm part of their letter team. As an additional note about me, I am not
Neil, can you
anti.
hear her okay?
Am I too quiet?
Just make sure you get close to the mic.
Okay.
There you go.
As an additional note about me, I am not anti-law enforcement. I come from a long line of family members who have worked in the field, and I respect the work that is done. I also have an incarcerated loved one and have been more than shocked to learn how people are treated in prison. Medical treatment. My loved one has been suffering with knee pain for over a year. He has submitted kites and shown up for multiple appointments with the doctor, but nothing has been processing. The doctor is either not there to be seen, or they act like they did not discuss getting an MRI to diagnose the problem. What is an acceptable time frame to make a patient wait? We are not talking weeks or even a couple of months. That would be understandable. Over a year is excessive. Even more shocking is that I learned after starting to read letters from our members that this is not an unusual occurrence. People with critical, life-threatening illnesses are forced to wait months, years, some losing their lives to treatable illnesses because care is delayed for so long that they are no longer treatable. It's horrifying. I understand that there are challenges to providing care for so many people, but it's unacceptable. Food service. This is not a new topic for this board, so you know all of the complaints. Change is not happening fast enough, and it's time to get real. We saw the reports you included about nutritional adequacy, but that is based on the first prepared tray, put together in the kitchen, not what is actually served. It's also based on the posted and approved menu, which doesn't include substitutions, which happen all the time. We have had at least 2 incidences in the past 6 months where Wells Conservation Camp was being served a tortilla with a smear of peanut butter because they ran out of food. How does this happen? NNCC was reported for wastewater backwashing into the kitchen, and it was reported due to the smell. How long was that going on? Is it even fixed now? SDCC doesn't have hot water again regularly. How are culinary workers washing their hands? Summer heat. This is another topic we've heard before. While it's crickets now, give it a few months. What is going on? What are we doing next summer? Why aren't we asking these questions? NDOC needs assistance. Incarcerated men and women are suffering. When is this issue going to become? Thank you.
Thank you.
Good morning. Good morning. Governor Lombardo, Attorney General Ford, Director. I think I want to touch on something because I have been personally affected by having a loved
Please
one
state your name.
incarcerated. Oh, I'm sorry. Tanya Brown, TonjaBrown, Advocates for the Inmates and the Innocent. I'd like to say that I have been personally affected, my family, of having a loved one die in prison from lack of medical care. During the wrongful death suit that we had filed, and the deposition of several, including the Dr. Karen Gattney, it revealed quite a bit. And I don't know if it still exists. I know it has for years. But the prison has a board called the Utilization Review Committee. This committee, it makes the decision on who gets treatment outside. Some do, some don't. I know in our particular case, it took quite a while for him, my brother, Nolan Klein, to receive Hep C treatment. By the time they started it, it was too late. Also, he was never treated for something that was so simple to treat called hemochromatosis, which is basically it's an iron overload where all you do is take out the blood. It's like giving a blood donation every few weeks. It did not. And how upsetting this is even speaking about it, because I don't think a lot of people understand. If he had received proper medical treatment, he would have lived. And this is according to the experts, even on both sides in the suit. If he had received proper medical treatment, which was not given by Dr. Karen Getney, just months before he passed away, the Honorable Judge Brent Adams ordered the Washoe County District Attorney to turn over the entire file in my brother's case. When the file was turned over, all the exculpatory evidence that showed another man committed the crime and other exculpatory evidence that was so favorable to his case, okay? And as his attorneys were ready to file motions for new trial and bail, my brother died. He died within 13 hours of his current attorney, Ms. Hearn, who was about to file motions for new trial and bail. If he had lived just an hour longer, she had filed that motion, I would not have to be fighting so hard to get a petition established for posthumous pardons on factual innocence, because if it had been filed first, we could have got a judicial review a judicial exoneration. So it's very difficult.
3 minutes.
Now I have,
You've reached 3 minutes.
okay, I just want to say that I have received information from inmates who have lacked getting diabetes medication, heart medication, and then I'll pick it up on the ombudsman on second public comment. Thank you. Have a
Good morning. My name is Joaquin Webb. That's JACQUINWEBB. I wanted to speak about the food and the culinaries in the NDOC, which is in the reports on the agenda for today. I was housed in the Nevada Department of Corrections from 1999 until 2019. I was also housed in from CCDC to High Desert to Lovelock to NNCC. Along the way, the food was not good. The serving portions were really bad. There was a lot of times of spoiled food, and you can smell it. Portion control was at a very minimum. There were so many people that were leaving culinary still hungry. When I got to NNCC, I was very privileged to work in the prison industries. And in the prison industries, I was able to make a wage where I was able to supplement, obviously, what I was being fed in the culinary. There were so many men that did not have that opportunity. They were going to bed hungry, which caused a lot of problems for people in general. I was able to work in the culinary for 3 months when I was at Northern Nevada Correctional Center. At that time, I did witness what we hear so much about the not fit for human consumption on boxes. I witnessed tons and tons of mice and the feces and the flour and the oatmeal and just the lack of care and concern for the people that were there. There was so much hostility from culinary to the units. I think that it could have been minimized by just getting a proper meal. I did notice that a lot of our problems that we did have happened right after feeding because there was so much anger over food. I think that the food service, the culinary work, free staff, they did try to make the best of a lot of the situations, but their hands were tied because the portions that they had, we never had enough food to feed a whole yard, ever. I'd never seen that while I was working there. And even when I left there, it was still a problem. It was an ongoing problem. I was working with Return Strong, and I got to read some of the letters recently, and it sounds like it's worse. It really sounds worse. I hear of people eating things that they should not be eating to supplement what they were being fed. These problems here, I feel like, can be fixed very easily. I hope that we can address this situation. Thank you for your time.
Thank you.
Good morning. My name is Tammy Berg, and I have a son
I'm sorry,
at
ma'am, was it Berg?
Berg, B-E-R-G.
B-E-R-G?
I have a son at High Desert State Prison. He was part of the transfer from Ely State Prison. I asked him to tell me some of the things that he was being fed. And so I'm going to read part of his letter. For breakfast, he gets 1 scoop of eggs that is powdered, 1 juice packet powdered, 1 packet of powdered milk, 1 juice box, 4 fluid ounces, 1 serving of grits, and 1 scoop of cold cereal, and 2 small round meat patties. I brought this as a visual. This is the size of his meat patty. For lunch, he gets a sack, which they receive at breakfast time because they only serve breakfast and dinner here. Includes the following: 4 pieces of sandwich bread, 2 pieces of bologna, a packet of mustard, a packet of salad dressing, which I'm not sure what he's putting that on, which is supposed to be mayonnaise, he says. 1 packet of Goldfish snack crackers, 100 calories, and a piece of celery. And then the opposite day, he says they get sandwich and a packet of Sunshine peanut butter, and then he sees a packet of Sun Chips and 1 piece of carrot. My son is turning 25. This is not enough food for anyone. I would challenge you guys to eat what they are being asked to eat. It is not the way we should be treating fellow human beings. Excuse me. My husband and I have made the difficult decision to supplement so that he can get food from the commissariat in order to get additional food. It is not enough. We wonder why the incarcerated are angry, as Joaquin said about, a lot of the fights and things like that happen in disturbances. They're either right before or right after a meal. You know what? I'd probably be fighting too if this was all I was eating. I also wanted to tell you, because it was touched on earlier, my son has chosen to do, I guess, what they call a bird bath versus being chained and walked like a dog, that was his words, to the shower area, where in many cases you don't even feel safe to do that. Again, not the way we should be treating our fellow human beings. He has been out since the transfer from Ely to High Desert. He has been outside 3 times for, I believe he said one of them was 30 minutes long, and that was long.
3 minutes.
Thank you.
Anybody else wish to provide a public comment? Do we have anybody online or on the phone?
No, we do not.
Okay. We will close the first opportunity for public comment, and we will move to acceptance and approval of the minutes for June 27th, 2024 meeting. Minutes are attached. Attorney General Ford, do you have any questions or concerns?
I don't. I move approval.
All right, we have a motion for approval. All those in favor signify by saying aye. Aye.
Aye.
Motion passes. We'll move on to agenda item number 4, receive a report from the Chief Medical Officer, Dr. Azam, for discussion only.
Good morning, Governor, Attorney General, Director. How are you? For the record, I'm Vincent Valiente, Inspector for the Nevada Division of Public and Behavioral Health, representing the Chief Medical Officer today. You already have a copy of our detailed report, so I'll briefly cover some points on the report. As required by the NRS, the Division of Public and Behavioral Health conducts regular inspections of state correctional facilities. Our inspections include medical, dietary, sanitation, which includes nutritional adequacy verifications, inspections. The division conducted medical inspections at 2 state prisons, state facilities, This year, Northern Nevada Correctional Center and Florence McClure Women's Correctional Center. Northern Nevada Correctional Center had 5 citations identified: life safety code, infection control, sterilizer testing and maintenance, sterilizer training, and medications expired. Florence McClure Women's Correctional Center had 1 citation identified. It was infection control. The division conducted dietary and sanitation inspections at 6 state prison facilities. A total of 14 dietary and sanitation critical violations were identified. This was an increase by 2 from the 2023 data. Ely State Prison had 3. 1 violation was identified at Lovelock Correctional Center. 1 violation was identified at Florence McClure Women's. 3 at High Desert State Prison. 2 were identified at Southern Desert Correctional Center, and 4 were identified at Northern Nevada Correctional Center. 3 of the 6 facilities inspected in 2024 had repeated critical violations. Please refer to our report for more details on these violations. No substantial nutritional adequacy violations were identified during the 2024 inspections. We continue at the Department of Division or Department of Public and Behavioral Health to advise the NDOC to enhance infection control prevention, early detection, and control measures at all facilities. Once again, for more information, please refer to our detailed report. This concludes my brief summary, and I'll be happy to answer any questions you have.
Any questions or concerns, General Ford?
Just a couple of questions here. You speak about, well, the report talks about 3 institutions, Ely, Lovelock, and Northern Nevada Correctional Center having critical violations associated with high temperature dishwashing machines. I don't know if you can answer this or not, but can someone, tell me what NDOC needs to do to address the high temperature dishwashing machines? So that, because it seems like that would resolve 5 of the 14 critical violations.
So this is James Miranda. That is being addressed, and these violations that I saw in these reports have repeatedly been coming up for years. This is the first time that we've actually got some infrastructure help on this. Governor has approved ARPA funds to come over to the Department of Corrections to address just the kitchen areas. We had a company called Cooks, a national company that came in and did evaluations of every kitchen to tell us what type of equipment that we need to replace and what needs to be repaired or can be repaired. Those were all part of the sanitation issues that were with the dishwashers and the cleaning supply distribution materials. But anyway, those materials and those equipment and all that is being addressed, where the governor asked that I prioritize those kitchen repairs and issues that were the ones that were the greatest numbers of violations over the years, or the ones that have been continuous. That's why it started at the Southern Desert Correctional Institution, and as of last week, they just finished the replacement of the faltered or altered equipment, the faulting equipment, and replaced the equipment to make sure that it's properly sanitized. They're now moved over to the High Desert State Prison, and they will continue to hit all the prisons until they are finished. But it was a funding issue that we finally got, and all that equipment is going to be replaced or repaired based upon what Cooks is telling us to do to pass these violations.
Thanks, Director. Mr. Governor, I have a couple more questions, if that's okay.
Absolutely. Before you ask your next question, General Ford, you said they're going to move. Did you have a total timeline to address all the facilities?
So there may be a timeline. I don't have it. We work with Public Works and with the companies that are coming in to do this after the repairs are requested. They just as they come in and as the repairs and the parts come in, they repair and replace.
And so the funding is not an issue at this point?
Not that I know of, no.
Okay. Thank you, General Ford. Go ahead.
Okay. Second question relates to 6 deficiencies identified related to medical and dental inspections, including ensuring the sterilization of medical and dental equipment on a regular basis, and then the expired or outdated drug or biological supplies. Wondered if you can speak to the latter, the expired drug and biological supplies. Somebody, I don't know who over there can do it, but.
What was the question again? Can you repeat the question for that?
Yeah, give me a little more information about the violations related to the expired and outdated drugs or biological supplies. What are we doing to address that?
That would be more of a question for Director.
Okay.
This is James Aranda. I don't know if Dr. Williams can answer. I know a lot of it was the, that they were expired is how do you get rid of the materials and the medications, not just that they were being used. It was how do you
Okay.
get rid of them, and I don't, do you want to answer any of that, Doctor? You got to get up and hit the mic.
Dr. Williams, Medical Director for Nevada Department of Correction. Yes, as the Director stated, it was mostly issues of how the medications are removed and discarded. Not that they were in line to be dispensed.
So how has that been resolved?
The DONs are responsible for making sure that the pharmacy nurses have the medications out of rotation sooner, and that we have a process, even if it's with a vendor, for the disposal of narcotics or other medications that are non-narcotic that we just some you can just throw in the trash. Some you have to be a little bit more cautious about how you dispose of them, like narcotics.
So is it addressed then? I mean, that's the question. Have you figured out how you're going to address this critical violation?
Yes, sir. Yes, sir.
All right, and the final question I have, Mr. Governor, is related to, I'm just going to say, we keep hearing concerns about the nutritional adequacy of the meals. I know that no critical violations were found this time, but obviously public comment continues to let us know about that. And meeting after meeting, we continue to hear concerns about the meals. And I just want to continue to put on record, we need to continue addressing that, looking for ways to address that so as to accommodate what's needed inside the prison walls there. So that's all I have, Mr. Governor.
All right, thank you. I have no questions, so if you have anything else, Mr.?
I don't, Governor.
Do you say it Valiente?
Valiente.
Valiente.
Yeah.
Thank you.
Thank you, sir.
We'll close agenda item 4, move to agenda item number 5, director's comments and departmental updates. Director Zarenda, it's for discussion only.
Sure. What I thought was important to bring up to the public information is that, first of all, they keep getting asked about the implementation of tablets for the offenders in the population. That new company that's taken over, it comes into effect on January 6th. It's Viapath. They are taking over for the current telecommunications company called Securus. The infrastructure of that, they cannot start implementing some of the IT structures until they physically come into the agency. They can't do it before their contract starts. So on day one of the January 6th, they will take over the telephones communications without any interruption, because they will just take over what's currently in place. What is being added from that point on is the infrastructure and IT to be able to provide every offender a tablet. They came and said that with all the implementation issues that they saw around the state between the fiber optics and the microwave issues, they believe that the implementation will actually be in place by April 1st, after they get all the equipment that they need in. There'll be more on this with training of all the offenders, training of the staff, giving public information, which we've already, the company Viapath agreed to sit down with the public, probably through Return Strong, and giving them education on what the tablets will be doing, any questions about the tablets, and what we can do to make sure that the tablet implementation is successful and goes smooth. The other part I thought was important to bring up is since I arrived here back in January of '23, was the issues of vacancy rates with correction officers. Just so you are aware, which you haven't heard today, was the cancellations of visits because not enough staff. What has happened over this 18 months to 2 years was the agency got contracted out a company called All-Star that really pushed the recruiting, hiring processes for correction officers, the reaching out and the doing all the implementations of whether it's background psychological tests and doing it at a quicker rate and getting people online faster allowed us to reduce the vacancy rate dramatically. We had just yesterday was our last graduating class in Las Vegas for correction officers. And this is the first time that they have ever seen in history that the southern part of the state has 0 vacancies for correction officers. So there's none. That is enormously important when you come down with staff and offender safety with those areas that were used to in the past of not providing a staff member because they were short. It's also relief on the officers from being exhausted and mandatory overtimes. That won't last to be 0 because we already have about 30 that are retiring at the end of the month for the end of the year. But we do have classes that are prepared to start pretty quickly and right away to keep that going. The rest of the state, Northern Nevada Correctional Center, their vacancy is below 8%. We still struggle with Lovelock and Ely. Their vacancy rates are still over 30%. Lovelock will go down with this next academy class that has 15 officers that just graduated from the academy. They're going strictly to Lovelock. So those numbers you'll start seeing being reduced in the vacancy rates. And with the move that everyone was talking about today with Ely and High Desert, the new staffing ratios have been reduced at Ely, so we'll see those numbers of vacancies go down just because they will not need the additional officers that they did with the higher class population. The next step at the Ely is to bring in the programming and the tablets that is in dire need of with that type of population. The tablets, I think, are going to provide majority of that programming and education. However, we still have other avenues of additional education and programs being added to the Lovelock, to Ely Correctional Center because of the lower level population. But that's all I have.
For the record, Governor Lombardo, a couple questions, Director. You mentioned Lovelock, and your recent report dated 12/2/24 shows a 34% vacancy. So what was the recent graduation?
There was 15 correction officers will be added to that.
So that's minus from the total of 66, is that correct?
Yes,
Okay.
which will bring it below 30%.
And then on Ely, is that still accurate, a vacancy of 43?
No, that's been reduced too. We didn't graduate yet, but we have a total of 6 correction officers at the graduating class. This also hasn't been reduced based upon the staffing needs at the minimum staffing levels have also been reduced. So the next update of this will have the new correction officers that were added and also the reduction of the post plan, which will also reduce this below 30%.
Okay. And do you have any timeline on the tablets with secure, or with, what was it?
Viapath.
Viapath?
So they're coming in actually tomorrow to provide a implementation plan and an IT plan of how it's going to look. They were being very conservative to say that they'll be implemented on April 1st, the first implementation plan. They believe it's going to be sooner, but they did not want to say that because it depends on how the IT pieces work in place with the amount of either microwave or fiber that they have to add to it under their Sean Tech contractor.
Okay. So do you know the total number off the top of your head since January 23. So I recall 35% plus vacancy across the board. And
So
now
the-
you're reporting on your recent report 17. Is that accurate?
17 is accurate. Actually, when we started the legislative session, they did the overall vacancy for the state was at 32%, but it depended on what areas of the state, because we were over 50 at Ely, and close to mid 40% vacancy at Lovelock. So on the overall, it was 32.
So you got to be commended for that. So the vendor All-Star, is that what you mentioned?
Yes.
Do they do POs too, public safety?
So that's primarily all they do, and they also do.
You mentioned corrections.
They also do medical staff. They do public safety, they do police departments, and they do hospitals. Currently, All-Star is being utilized by Health and Human Services and the Department of Corrections for medical clinicians.
Have you had any conversations with Director Tagliati for DPS?
Yes, we've
Okay.
shared it all.
All right. Thank you. Confirming no further questions, General Ford.
None here, thank you.
All right, we will close agenda item number 5 and move to agenda item number 6, the medical division update from Dr. Williams. Doctor, it's for discussion only.
Governor Lombardo, General Ford, Director, thank you for this opportunity to share some information with you. When I had a discussion with the director about coming to serve here, we talked about a number of the challenges here. And the first thing I did was go around and look at all the facilities and meet all the staff, pay attention to some of the workflow to get an idea of some of the root causes. I've had an opportunity to talk to or listen to the Return Strong entity and hear some of their concerns. And I have also reviewed some grievances myself, and I've had an opportunity to sit in on some of the discussions on the lawsuits. And I would agree that, there's considerable room for improvement. That's where I've been putting my effort since I have arrived. I have looked at policies and reviewed some of those and rewritten some things, updated things and edited some of the verbiage to bring some accountability and add metrics to the expectations. As we know, 97% of the incarcerated population is going to return home to the community. We talk about correctional health care, and we say that correctional health care is actually community health care because they are coming back to us. And because they are coming back to us, it's important that we are attentive to their needs while they are with us, because that can affect their direction. I spend some of my time working with the American Correctional Association, and I serve on a number of the committees, Healthcare Committee, Behavioral Health Committee, and I am a health commissioner. In that capacity, I have the opportunity to weigh in and provide guidance on the policies and expectations nationally for correctional health care. And so I bring that information and that experience to the table here to bring some improvements. I'd like to share with you what we've done so far. We have been focusing on staffing, bringing medical providers to much-needed places. We have managed to put a full-time provider in place at Ely, as well as Lovelock. When I was discussing coming here with the director, one of the biggest gaps and most difficult places to staff was Ely. Again, we now have a full-time provider there. That's a major win. We are partnered with UMC Healthcare to help bring some specialty telemedicine to the table. I believe that that will be impactful as we hope that that will decrease some of the movement and increase and improve security in the facilities because it does not pull the officers from their assignments. We've appointed a new director of mental health, and we are working, as the director mentioned, with DHHS and All-Star to identify correctional counselors as well as nurses. That initiative is a collaboration with DHHS and Veterans Administration and NDOC. In the substance use dependency treatment area, we've also been working with DHHS with the Bureau of Behavioral Health, and they have facilitated a contract with an outside vendor, MindCare. This vendor will help us assess our medications for opioid use disorder treatment program and help us expand. Presently, we are able to continue treatment when an offender moves from the prison to, from the jail, I'm sorry, to the prison. If they were initiated in the jail system, we can continue that in the prison system. We've had great success with that. Our goal is to expand that project into the population that is already incarcerated, because as we all know, opioid use is one of our main criminogenic factors. We were also awarded a position in this year's cohort from SAMHSA for the Gaines Policy Academy. Together with the MindCare project, they will help us with project assessment, determining what are the best practices, and ensuring that our policies are in line both on the federal level as well as consistent with all local laws. Our pharmacy has engaged in a new gate medication program. This will bring some efficiency and cost savings to the table, because instead of filling prescriptions and giving them out and maybe they're used and maybe they're not, we'll be able to give our offenders a card that they can get their prescriptions filled at any major pharmacy, including CVS, Walgreens, Walmart, and that will avoid waste. Our pharmacy has also gotten us enrolled into a medication donation program. So abandoned medications where the prescription has been filled but the patient hasn't picked them up, we'll be able to take those donations. They've never been dispensed, so we can repackage and dispense them. That will bring a significant cost of avoidance to the agency and to the state. We want to move forward with shoring up our relationships and partnerships with other state agencies so that we can utilize our resources more effectively, more efficiently. We want to be good stewards, fiscally responsible, and I believe that those partnerships are important for doing that. Our goal is to implement an electronic health record system that will help us with accountability, to ensure that patients are scheduled on a regular basis, seen on a regular basis, and I'm confident from past experiences that that will address a lot of our concerns and our challenges with patients that are not getting the care that they should be getting, and they're not getting their refills in a timely manner. This will also be facilitated by bringing the new SIPS contract online, which is the correctional inpatient pharmacy software. And we are also working on an RFP for BD Pyxis, which is a controlled substance management cabinet that will prevent diversion in our prison system. So we're making strides to work on our policy, work on our culture so that it is more humane and more empathetic. Our commitment is to improve the health care for our offender population in the state of Nevada and bring it in line with the expectations and practices that are observed nationally. Yes, sir.
General Ford, do you have any questions?
I don't. That's a good report, Dr. Williams. Thank you so much, and I appreciate your comments.
Thank you, sir.
So for the record, Governor Lombardo, I have a couple questions, Dr. Williams. One is I want to go back to General Ford's previous question in the previous agenda item on the medication expired storage and securing, and I guess disposal would be added to that. In particular to the Northern Nevada Correctional Facility. So out of 6 reporting periods, they've failed. And that sounds like a really, really simple process to me. Maybe there's something I don't understand, but how can we not fix that in over a period of 2007 to 24?
I cannot speak to the previous performance. I can share my perspective is that by updating the policies and procedures, by defining accountability and metrics, I am confident that we will get where we need to be. I believe we have a good team, and in every team, we have to make sure that we have the right person in the right seat on the bus. And if they're not a good fit, then we have to give them the opportunity to do something else.
So do those people, that team, do they report to you or to the warden?
There's both. So in corrections, the warden is always going to lead that facility. But there's a partnership. And I am the medical director, and so I do take responsibility, and I do have every intention of holding my people accountable to support the efforts and initiatives of the warden.
Okay, so Director Zarenda, can we make this an agenda item for the next prison commissioners? Because I don't want to wait the 3-year gap to determine whether we've had progress associated with that particular issue.
Yep, noted, it'll be on it.
All right. The second question, Dr. Williams, is you mentioned electronic health records. Is there a funding void there, or is there somewhere else in the state holding up the process? What's the hurdle there?
So there is a funding void. However, I have been working with Director Zarenda and Director Whitley, and I believe that there is an opportunity for DHHS to help support that initiative.
Okay. Is that something that you would ask my help in addressing, or Director Zarenda, can you
Absolutely
make a statement on that?
So, yeah, so the funding or the resources piece of the electronic health records is coming through Health and Human Services, and we've been working together to find a company to be able to provide the electronic health records, and I believe it was narrowed down to 2. And and Dr. Williams may be able to answer better, but I think we're waiting on Health and Human Services to give us the go-ahead.
Yes, sir. We did narrow it down to 2, and then we got proposals from each entity, and one entity stood out, and they were able to come to the table and offer not just the software package, but the infrastructure that goes along with that package. I mean, having the software, but not having any computers to run it on doesn't really get us moving into the future. We really need to move into the future. That one entity was prepared to come to the table with software and with computers and scanners.
Okay. So, Director, advise if you need some help in that position. And then the last question would be the holding cabinet diversion.
Yes, sir.
In the pharmacy.
Mm-hmm.
Is that another bid? Is that a software thing? Is that a labor thing? What is the issue?
That is an actual tool. It is a like a safe, but not as simple as a safe. A safe is not going to get it. So it is a medication cabinet, and it does have software associated with it, and it will deter diversion because the staff have to actually log in with their code. So it will track directly.
I'm familiar with the process. I
okay.
just want to ask what's preventing it from taking place.
The last that I heard was we had to do an RFP.
I'm sure that's the case, so. Is there a holdup on the RFP?
The only thing I could do is look into that. I have no idea.
Okay. I mean, both the health records and just my minimal knowledge of healthcare, health records and pharmacy diversion have been in place for decades.
Yes, sir.
You know, especially in the electronic space. So, well, we need to move that along as soon as we can.
Yes,
Thank
sir.
you.
Thank you.
Thank you for your presentation. All right, we'll move on to agenda item number 7, administrative regulations not subject to NRS 233B process for discussion and possible action. Director Zarenda.
This is James Aranda for the record again, and neither of these administrative regulations are part of the 233B process. They're regular administrative regulations that go through the agency and then through the BOPC. Both of these were on the agenda from the last BOPC and was re-brought back to this after some questions with the Correction Officers Union. From the time that it was submitted on the first BOPC to this one, there has not been any changes. The agreement with the FOP was consistent to what we just needed to explain of what those changes were. These changes were basically part of a statewide audit by LCB into use of force. And these were the recommendations that they made to finalize the audit to be in full compliance. Just want to say that both of these administrative regulations have been already in place. They were put in place AR 362 in September 7th of 24 as a temporary, waiting to come back to the BOPC for finalizing. AR 412, which is the Armory, was put in place in August 29th of 2024 as a temporary, also waiting to come back. So as was mentioned in the last BOPC, the AR 362, we changed recommended that we changed, and we did the name of a range master to make it consistent to national standards as a firearms instructor. We also changed the title from an employee development manager to a different position, a title of employee development administrator, which was able to get more qualified candidates. It also changes employees have to, when they go in the last AR 362, employees were able to practice at the range by themselves. It was changed that was some safety and learning issues that was recommended in the audit that we have a firearms instructor present whenever they practice on their own, which was the change to make sure that not only the safety of the range, but also that if someone is disqualified or did not qualify for firearms, had someone there that can tell them what they're doing wrong so that they don't continue the same wrong practice when they go back for testing. So it was just to make sure that when they practice on their own, that their firearms instructor has to be present. They also it added the ability for the officers to have the access to the range while it's open. And what happened before is even when the range was open for qualifications, the staff couldn't practice on their own until the qualifications were done. This will allow it to happen simultaneously. There's been also just the minor changes that have been formatting changes so that it fit a little more clear and consistent to other directives which are out there. And then a change in the confidential manual requirement for the training directive requirement was actually added for accountability purposes. And that was it for AR 362, weapons training qualification, looking to have it as a permanent AR through the board.
Any questions there, General Ford?
No, sir, no questions.
AR 412.
So the second AR 412, armories and weapons and control, that was these changes were also brought up through the recommendations of the use of force audit. The first change in it was to define which actual staff can be assigned to armed post, which would add in that only certified and qualified staff can be turned into armed post, which was not in any AR at the time, which it is now. The other one was added the weapons that are actually authorized. The last AR was not specific on the actual armory authorized items. It allowed some staff to have their own personal items, weapons, as long as they certified. That is no longer the case. And it also, in the last administrative regulation, had the use of and certifications of the shotgun, which were actually removed from Department of Corrections, so it was eliminated out of the AR. The next one was that it added Inspector General of having authorized weapons. The last administrative regulation listed it as similar to the correction officers working in the facilities, and it added a section that was recommended under use of force specific for the Inspector General. There would also the storage of firearms. Firearms were stored in control centers, which was a violation in the use of force audit. It had to have them all separated into its own armory and its own inventory. That was added. It also added and incorporated an ordinance committee review, which the committee review was added to authorize any suggestions for new munitions and go through a committee rather than each facility being on their own. It would also make it consistent with statewide standards and statewide agencies so that one facility is not going to be any different from the other, which the last AR allowed each facility to have their own direction and what munitions they actually order and have. The last thing is that it, as I already mentioned, it prohibited the use of personal weapons. The last AR allowed the staff to have their own weapons. The use of force audit violated the department on that, so it was eliminated the use of personal weapons. And the last thing was also the formatting was changed a little bit to be consistent to other ARs. That's all I got.
Just an administrative question, Director. How come we have a 412A and B when they're listing the same descriptions?
So, and 4A.
It's the red line.
Yeah, what 4A and
The red
4B
line?
is just that what the changes were made so that you can see from the last AR.
Thanks for that clarification. Any questions, General Ford?
No, sir.
All right, it's an action item. All those in favor of it, I'll entertain a
You
motion
want-
for approval.
You want to take them both together, Governor?
I'm sorry. Yeah, let's take them both
You want to take
together.
them both? All right, I move approval of 362 and Forest Well.
Is that sufficient, Danielle, or do we need an A, B? That's sufficient? Okay, we have a motion. All those in favor signify by saying aye.
Aye.
Aye. Any against, nay? Motion passes. I guess I could tell by two voices. All right, let me return to my agenda. And I believe we're at the second opportunity for public comment. Do we have anybody there in Las Vegas for public comment?
No, we do not, sir.
Do we have anybody here in Carson for public comment? Is everybody going to make comment in the second session here? Two? General Ford, can you manage the meeting for a couple minutes for me?
Yes, sir.
I'll be right back.
All right, let's bring up the first individual for public comment in Carson. Thank you. Go ahead and proceed.
Tanya's going first. She got to go back to work and I don't.
Okay, go ahead.
Thank you, Jody. Tanya Brown, TONJA, Advocates for the Inmates and the Innocent. I wanted to touch on something. In 2023, AB 452 passed. It was the Ombudsman's Bill for NDOC. And so a few weeks ago, I had received some information regarding an inmate in Ely. And the person I contacted, I suggested they reach out to the ombudsman, thinking it had been filled by now. I called NDOC. There's no information on the ombudsman, on the website. Staff doesn't know about it. The administration office doesn't know there's an ombudsman. It hasn't been filled, or they know nothing of it. Okay, so anyways, this individual, I ultimately had to go to the Inspector General's office because of my concerns over this inmate in Ely. His life was being threatened by inmates, and prison guards were causing some problems and issues. So it was becoming a concern. Okay, so then I've also, and Jody can also agree to this, during the the Joint Interim Standing Committee on the Judiciary, a recommendation was passed. I won't say what it is, but anyways, it was passed. There was a bill moving forward, and her Return Strong organization, my organization, MassLib organization, is working together on this bill moving forward. So during a discussion that we had in August with the organizations, it was suggested that, if you want to reach out to your families, or whatever, and with some input from the inmates, which I did. And so this is where the issue was. There's no ombudsman, and then there was an inmate filed a grievance against another inmate for supposedly making false or spreading false information about letters. I have received letters dealing with this legislation, and the way that the grievance was handled was not done properly. I was never contacted to clear up anything at all. And it bothers me because this information will ultimately go into the other inmate who got the grievance filed against them record, which will ultimately affect possibly any future pardon that they are looking for, any parole hearing, because it's a write-up, it's a grievance, it stays there. And so I just wanted to make sure that these letters that I have received from men and women, and because of what our organizations, because we're collaborating together, they won't be impacted because they want to give their input into the legislation in the future. So I'd like to know when
You've reached 3
who the
minutes.
ombudsman is going to be, so I don't have to go to the Inspector General's office anymore. Thank you.
Thanks, Tanya. And if it's anything else you want to say, just write it and you can submit it as public comment as well.
Okay, thank you.
Thank you. Thank you so much, ma'am. Go ahead for your public comment. 3 minutes, please.
My name is Jody Hocking, and I am the founder and director of Return Strong. I have an unusual comment for the second comment period. I don't usually stay for this one, but one of the things as an organization, first I just want to say that one of our core values is that we really believe that everybody deserves to be treated humanely and respectfully, regardless of their convictions, and that when we allow the dehumanization of people that we've heard about today, that we've been hearing about regularly and ongoing, and we don't do anything, it makes us part of that broken system. And so the reason that we're here all the time is to try to make sure that that accountability happens. One of the things that, and I'm talking more to the board than I am to NDOC today, you get off the hook on this one. We've gone back through BOPSI meeting, we call you guys BOPSI meeting since January of 2023. Reviewing the questions that are asked, what they're asked, how they're asked, and we have concerns that this committee, even though there are questions that are asked, they tend to focus more on like infrastructure issues than getting to the root of the problems that are plaguing our prisons. Our belief is that there are a few issues that underlie why that happens. AG Ford sits on the board, and thank you very much for participating. This isn't a bash at all, but we believe there's a conflict of interest in terms of the AG's office being on an executive board that also that office has, Randy's here now, that also represents NDOC in lawsuits. So at what point is there a conflict or a lack of meaningful accountability or oversight to occur when those two roles are really inherently at odds? The Secretary of State, no offense again, this isn't his wheelhouse, prison. So sometimes we think it's just that people don't know what questions to ask. For instance, the food today and the nutrition reports, the reason that they are not failing, the simple answer is the first meal to come off of that line gets wrapped on a tray with saran wrap, and that's the one they inspect. That's not the one that is being served on units. That's not the amounts that are being served on units. It's not after bugs are found in units. If they were, they would take that out and wrap a different one. Like, there's simple answers to some of why these things are going wrong. If we don't ask the right answers, we're not going to, or ask the right questions, we don't get the right answers. They told me I could have.
Jody, thank you so much. Jody, you should put it in writing and you can submit it. We can certainly consider the rest of your comments in that regard. Thank you.
All right, thank you.
All right. Is there anyone else there for public comment?
We're not seeing.
Yes,
any,
no?
General.
Oh, okay. I'm sorry. I know you were back, Governor. You can go ahead. Sorry.
No, thank you. So if there's no further public comment, we will close the second opportunity for public comment and move for adjournment. All those in favor signify by saying aye.
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 Thanks so much.
Thank you, everybody.
Happy holidays, everybody. Bye-bye.